Wow. I don't know. I might as well go home. Save everyone 15 minutes. So I am masochist, I guess. I have no disclosures. The only relevant disclosure I have is that I have been doing this for 10 years in solo private practice in urban Los Angeles. I don't think I'm crazy. I think it can actually be done. My goals for this talk are essentially to make a case for starting your own practice. Where's Ben? He needs to listen up. Demystify the myths and provide practical information if you are actually one of those people who is thinking of doing this. Share some lessons that I learned. I didn't do everything right all the way along, and I have made some mistakes that I'd like to share, and empower you to carve your own career path. I think that's the most important thing. Whatever you do, you are in charge. And I think if anything you take away from this lesson, this session this afternoon is you should not be unhappy whatever you're doing, and you should take charge of that. How many people here are solo private practice? He didn't tally that. Awesome, we have a few. How many people regret doing that? Anyone? No. So take that as a lesson. How many people would have loved to be in charge of their entire 100% of their whatever job description if they could and they weren't afraid of doing so? A lot of people. So there is some buyers in the audience for this, and I'm hoping to convince you. I will tell you, why do you start a private practice? It's extremely liberating and very, very rewarding. Everyone who's done it will tell you that, hands down, nothing competes with that. You're autonomous, you're independent. You get to exercise your creativity. All along, you play by other people's rules. Here, you set the rules, and it's so empowering. I can't say enough of that. You dictate the efficiency of your practice. You know, we're so bogged down with bureaucracy, usually, wherever we're working, and it kills us. So here, you get to dictate the efficiency. You set your own lifestyle. If you want to start at noon on Mondays, which is how I do my life, you can do that. No one is going to tell you you can't do that. And you possibly can make more money if you're smart. This used to be a reality. It's not necessarily true these days, but you have to be smart about it. And you're being your own boss. There's nothing like that. If you've ever been an entrepreneur, you'll know that. But there are challenges. I'm not going to deny that. Time management is the biggest challenge. Money management is the second biggest challenge. Like he said, you're as poor as you spend, so you need to watch the expenditure. And when you're in private practice, typically you're spread thin, you're going to multiple different hospitals, you need to manage your time, otherwise you'll have no time for your family. You need to be comfortable being a small fish in a big pond. And most of us coming out of training have a bigger ego than our heads, and we think we're something, and we want to take that to our career, think that we bring a lot to the table, and we're used to being a bigger fish or want to be a bigger fish. If you go into solo practice, you got to put that behind. You got to deal with hospital politics, and you have to be comfortable with your voice not being heard on a hospital level. You have to learn how to contract and negotiate your contracts. Again, I'm not talking about employment contracts, insurance contracts. You're the person who's going to be talking to insurance companies. And so far, you've been protected from that all along in your career. You are always on call. There's no question about that. I've been on call 365 days for the last 10 years of my life. And I still think I'm well rested and I do okay. But you have to accommodate for that, and you have to be aware of that. Coverage is a problem. I take my phone everywhere and I never buy a non-refundable ticket. If I'm somewhere and I need to go back, I do go back. You need to deal with employees, you need to hire, fire, and believe me, that's the biggest headache of any practice. You need to learn how to code, bill, and collect, and you need to oversee that. And you need to accrue patients. Patient referral isn't automatic. So there's a study out of the Physician Foundation from 2014 that said that in 2012, 25% of medical practitioners were in solo practice. By 2014, it was down to 17%. And in 2019, I don't know what the numbers are, but I'm sure it's less than 10%. And this is all medical practitioners. It is not just surgery. So why is that? Well, the healthcare landscape is changing, and the future is really unknown, and that's why a lot of people are scared of doing this. We don't know how we're going to get paid, where we're going to get paid, and whether or not we are going to get paid. There's this false impression also when you come out of training that when you're in private practice, your clinical cases aren't challenging. You're really just doing lumps and bumps, and who wants to do that when you're coming out as a star? And it's honestly, the business aspect of it can be very intimidating. But, so I would say, even though I'm a big endorser of private practice, don't do this coming out of the training, straight coming out of training. No one coming straight out of training should even consider doing this. Always start with an employment model. Whether it's good, bad, or not, you will learn a lot of valuable lessons out of that first employment, okay? You get the clinical experience that you lack in training. In training, you always have a backup. When you come out and you are the big fish, or you're the big deal, there's no one behind you that can accept responsibility for your patient care. You need to experience that, you need to learn that, you need to gain the confidence that you need out of a surgical volume. And so join a very busy practice, and that's very important. Now, establish a reputation. So choose the place you're gonna go and establish your reputation there well. That's gonna pay off in dividends down the line. And also build a referral base. If you do a good job, people will send to you personally and not to your group. And once you get to that point, then you actually have options in life, okay? And also you can learn how to run that surgical practice, you know? If you pay attention, there may not be transparency, but if you're smart and you pay attention, you will learn a lot of pointers from how they run their practice. And most importantly, do not sign a non-compete, okay? That is very, very important. Now, some states like California, it's not endorsable. But other states around the country, that's not true. So you need to make sure if it's in your contract, take it out. Get a lawyer, take that non-compete out of there. The last thing you want to do is go somewhere, establish yourself, and then have to leave the area after you dissociate. And understand that 70% of surgical trainees leave their first job within the first 3 years. So leaving your first job is not a loss, and it's certainly not because you were incompetent or something went wrong. It's just an experience. It's an extension of your training, and look at it that way. Now you've decided to leave and you decide to start your own practice, now what? Okay, so there are a lot of things you need to learn and do, and I'm going to just briefly go through this. Some of this has been already touched upon, and some of it will come down the line in the next talks. But first, you got to learn the logistics, rules, and the regulations. You pick a name, you pick an internet domain, you incorporate, you get a state license, you register your incorporation with a state and get a tax ID. If your name is unique, you trademark that. You need capital, okay? Nothing grows out of nothing. So you either need to go and get a business loan, or you need to self-finance if you have savings. And most importantly, surround yourself with smart professionals. You don't have to know how to do this all. There are people who get paid who know what to do. You need a corporate attorney, you need a healthcare attorney, you need an accountant and an insurance agent. You need a medical malpractice agent, possibly an estate attorney down the line. You need an employment attorney and a business banker. This sounds like a lot, but believe me, this will save you a lot of headaches down the line. What do these people do? Well, a corporate attorney will set up your corporation, review every single contract, even my lease. I've been a tenant all my life. I'd never read a lease, but this one, I had the corporate attorney read it and revise it. This is very important. Everything from here on as a corporation is a partnership, and you need to protect your corporation. An insurance agent, you can't believe how many different insurances you need. You need liability, you need workman's comp, you need a specialty-specific disability, and that's very important as surgeons, and specifically as laparoscopic surgeons. If you can get it for your laparoscopic surgery disability, that is very good. If you can actually find a plan like that, that means if you can't do laparoscopic surgery, your disability kicks in. That means you can still do open surgery, you can still have a practice, but you can't do lap surgery because let's say your wrist hurts and you can't hold a camera anymore. Those policies are hard. Shop around, find one that's as specific as you can get, and that'll save you well in the long run. Business interruption insurance, super, super, super important, okay? Your disability is only limited. In California, disability insurance only pays $15,000. That is not gonna even cover half of your personal expenses. You need something to cover your business. A few years ago, I got cancer. I had to stop practicing. That business insurance is super important to cover your overhead. Don't oversee that. And then you need an umbrella policy to cover everything because now you're a doctor and everyone wants to sue you. You need a healthcare attorney. There are a lot of laws that I don't understand. I don't really intend to understand. But you need someone smarter than you to decipher that for you. Stark laws, anti-kickback laws, HIPAA, high-tech, red flag laws, there's a lot of them. I'm not going to go into that, but you need someone smart to go over that with you. And then you got to fill out forms, God forbid. At the beginning of your practice, you're just constantly filling out forms. You need a state license, like Ben alluded to. Hospital privileges, all of these take months and months and months. The hospital privilege part can be very political, so be aware of that, and don't get upset if you find roadblocks upon you getting privileges. You need a DEA license, an MPI license, you need PCOs. There are some institutions around the country that will verify all your credentials and store them indefinitely, because you're gonna have to keep going through this every 2 years, and it's a pain in the ass, essentially. Now, medical malpractice. Ben alluded to some of this. There are 2 types of malpractices, and coming out of training, you may not be aware of this. There's occurrence policies, which means that they cover you for any incidents that may have happened during your time of coverage. That means once you terminate and you move on, you're still covered for whatever you did last week with their while on their insurance policy. And there's usually a 1 to 2 year lag time to get sued from the time an incident actually happens. Now, occurrence policies are very rare to come about. So most policies are claims-made policies, meaning that you are covered for the claims that are made during the time of your coverage, meaning that if you did a lap chole 2 years ago and you got sued today, you need to have been covered during the lap chole and also today. Now, if you're gonna leave an employment contract, typically you're covered until you terminate and move on. Now, if you move on and tomorrow you want to open your own practice, whatever you did a year ago, that policy doesn't cover you anymore unless you get a tail coverage. And that's super, super important to get tail coverage if your previous policy was a claims-made policy. So all of this said, now the fun part starts. You actually get an office space, you have to buy equipment, you don't need a Taj Mahal, you don't need a big office with fancy chandeliers, keep it simple, contain your costs. It's okay to sublease, it's okay to get a two room, small office, less than 1,000 square feet to begin with. Don't jump in and buy something right away. You have no idea how your practice is gonna go. Don't even sign a long-term contract. Short-term leases at the beginning just to get your feet wet and see what you're gonna do, okay? Now, as far as expenditures, buying furniture and equipment and all of that is fun and dandy, but money you don't spend is money you keep. So keep that in mind. A lot of medical instrumentation, including beds and autoclaves and this, that, and the other, it can be refurbished. You wouldn't know the difference if you saw them, but you could save tens of thousands of dollars by doing it that way. And don't get too caught up in things like EHR and computer systems and phone systems. At the beginning, you have 2 rooms in your office. You don't need a phone system. You just need something to answer the phone with. So don't get caught up, because all those things are super expensive, and the costs just adds up, and you're gonna have to maintain that cost without any income. Just remember that you have 0 income so far, okay? So keep that in mind. Next thing is employees. Now, this is the most stressful and the most important part of your practice when you're setting up your practice, okay? Do your due diligence, take your time, and don't rush it, okay? The knee-jerk reaction is, I need someone to answer the phone, hire the first person who comes to the door. Don't do that. You can use temp agency staff for as long as you need to do that until you find the right person, okay? This is more important than a marriage. This person will control your life. And it's really important that they're honest and trustworthy. I would say, and I would argue, after 10 years of having numerous employees, temperament, personality, and intellect out-trumps any experience, okay? And over, I've never regretted hiring someone who's kind and smart over someone who's got a lot of experience, but they're complete, anyways. They can't make a decision to save their life, okay? So it's very, very important. Listen to your gut feeling. Someone comes with a great resume, but it doesn't feel right, listen to that, okay? A bad employee is like a poison to your practice. They'll demoralize the rest of your staff. They will be bad for your patients, bad for your reputation, and lead you down the litigation path, which you don't need the headache for, okay? I hire with numerous interviews. Just recently I had to hire someone. I put an ad in Indeed. I got like 40 hits. I met every single one of them at a Starbucks one afternoon. 10-minute interviews, okay? After you meet a bunch of people, you nail it down to like the 10 that you like, you meet them a second round, talk to them more, and I make everyone do a working interview. 2 days in a row, they have to come. I pay them a minimal salary. They just sit there and work with my staff, okay? They don't have to know what they're doing. They can answer a phone. They can copy a piece of paper, but you need to see their interaction with your current staff, because if you hire someone that doesn't get along with your current staff, that's a recipe for disaster. I even actually have my staff at the end of a working interview fill out a form and tell me what they thought. They actually grade the applicants because they need to want to work with this person. Then you need an employment contract or an at-will employment letter, an employee handbook. Spend a little time making one. It's very important. It'll protect you. It'll protect them. And then do annual and quarterly reviews. Make sure they know what they're, how they're doing. You don't need too many people. You need front office, back office, and probably a clinical person if you can afford it. An MA or an RN is not critical in a surgical practice, but if you have one, it'll help with the efficiency. Now, the key thing with employees, you need long-term retention. You don't want to go through this process every other year. You really don't. You want to keep them as long as you can. That means you need to have them be satisfied. The thing you can't offer them are a lot of benefits that a big group can offer them. But you can offer them flexibility, competitive salary, and treat them like family, make them feel like they're part of your family. And the key thing, you're carrying a lot of stressors. Don't take that to the office with you. You absolutely cannot stress them out because you're stressed out. Firing, all I have to say is it's very difficult and very uncomfortable, and make sure that the process, you're protecting yourself all the way along. Now, I'm going to spend a few minutes, I know I'm going over. I'm going to spend a few minutes on insurance contracts, sorry. So there are multiple different players out there. There are PPO payers, there are HMO and IPA payers, and then there's Medicare, okay? PPO, you need to make sure that PPOs are in-network and out-of-network. This is very important that if you don't sign a contract with a PPO payer, you can still see their patients. Just remember that they have higher deductible and higher copay to see you. The HMO payers, now this is the key thing with HMO payers. They pay at a lower rate, but you count on their higher volume. The key thing is that don't get caught up with an HMO player early on. They can fill your practice with low-paying patients, and then it'll prevent from other better-paying patients, Medicare and PPO patients, to be able to see you. They overburden your practice, and they always pay less than you think they're going to pay you. They have different tiers, so the main thing with that is they have commercial patients, they have Medicare patients, and they have Medi-Cal patients. And when you sign these contracts, a lot of times they want to give you different payments for different peers. You absolutely say no to that. You read the fine print. You need to make sure they pay you whatever rate you negotiated for all the patients. Otherwise, your biller will be very confused. You have no idea if this is a Medi-Cal patient or a commercial patient. They need to pay, and they can do that. They just try not to do that if you don't read them. Read this stuff up front. Don't become dependent to an HMO payer, okay? They will drop you like a hot potato the next day if they can replace you with someone cheaper. And you do not want to all of a sudden wake up one day and lose half of your income, okay? Medicare, I will just say a couple of the good things about it. Medicare is great. You don't need any pre-auths. There's no denials. It's a very low administrative burden. They pay quick. The problem is they're the lowest payer out there, and this is a sample of what Medicare payments are like. So, sorry, I'm going to switch to I'm going to go back. How do you go back on this? Red goes back? Sorry. And because Medicare payments are so low, you can't negotiate at Medicare rates with everyone else, okay? Everyone tries to give you Medicare or less than Medicare. There's no way you can run a practice with Medicare rates, okay? Every contract with an insurer is negotiable, okay? Just remember that. Just because they told you they'll pay you Medicare rate doesn't mean you have to accept it. Pick up the phone, talk to them. The way you do that is you need to know your work. You need to know what they care about. They care about length of stay, they care about complication rates, and they care about your readmission rates, okay? Know those numbers for your own practice. Believe me, they know those numbers for you. They just don't think you know those numbers for yourself, okay? Your patients benefit because you're a laparoscopic surgeon, but guess what? Every laparoscopic CPT code is valued less than its open equivalent code. So you will get paid less even though you're providing a service to the patient and the insurance because the patients get out of there quicker. So you need to know that. So when you sit with the insurance director, you bring that up and he will accommodate you. I promise you that if you know what you're talking about. If you run a practice on a Medicare rate, this is a sample of a 8-case week. If it's all paid by Medicare rates, you will make $8,000 at the end of the week, okay? That's before taxes. There is no way this isn't gonna cover overhead or even anything that you get paid, okay? A practice is not sustainable on Medicare rates if you're in solo practice. Remember that. You need to fight for yourself. Like Ben said, no one is going to fight for you, okay? Do your own negotiations. Don't have your biller do that. You absolutely need to know your own outcomes. Be respectful, but it's a give and take. It's like buying a car. You need to be prepared for that. And at the end of the day, be prepared to walk away. Since we're so late, I'm just going to say 4 things. He touched on the patient satisfaction parameters. I will say that where solo practice surgeons succeed is the 4 A's of patient satisfaction. And I say it's 4 and not 3, and I'll tell you why. First, it's availability. That's our strength. We are always available, and patients appreciate that. Primary care referring doctors appreciate that. Be affable, be kind, be nice. A new consult isn't a burden, it's a gift. You gotta treat it as such. If someone calls you in the middle of the night, don't hang up on them. They probably need your help. If you're nice and you're kind, you will get the referrals. Be able. Now, this is the hardest thing for them to actually judge you by. Patients don't know how capable you are, neither do the primary care doctors. But practice safe medicine and protect your reputation in the community. And I would add a 4th one, affordable. Ever since Obamacare has come around, high deductibles, high copays, patients actually will forego the first 3 for a more affordable option. And try and keep yourself affordable if you want to compete in this arena. Thank you very much.
Thank you.